Scanning the room.
Hi, my name is Jocelyn Evernon. I'm in the PM program at Williston State College. Today I'm going to be doing range of motion, bed positioning, transferring, ambulation, and measuring and applying for TED-HOs. So I'm going to enter my patient's room and start. Hi, Mr. Smith. My name is Jocelyn. Today I'm going to be your student nurse. Today we're going to be performing some range of motion exercises. I'm going to be doing some bed positioning on you. We're going to transfer, ambulate, and I'm going to measure and apply some TED-HOs. Do you have any questions before I begin? So with no questions, I'm going to first check my patient's chart for any positional limitations because we will be doing some rolling, and I just want to make sure that we're not going to run into any problems there. And I am going to wash my hands and begin. So I'm going to move my client's bed to a nice working height and lower the bed rail closest to me. So to begin, I am going to only expose the extremity that I'm going to be working on. So we're doing range of motion on his arm. First, I'm going to start by supporting up above and below the elbow. So with extension, I'm going to make sure that his palm is face down, and we're going to extend 5 to 10 times. But for the purpose of the video, just twice, and that's with all of these exercises. Same with abduction. 5 to 10 times, but only twice, making sure never to push past any point of resistance. And the same for adduction, crossing that body's midline, but never pushing past that point of resistance, making sure the arm stays straight. And I'm going to move to my client's leg. Again, only exposing that extremity that I'm working with. Always ensuring that my client is their privacy is protected while doing so. So with the leg, I'm going to support at the ankle and the thigh, and we're going to do extension as well, creating a 90-degree angle between the bed and my client's leg. And we're going to do that twice, but 5 to 10 times in a clinical setting. Same with the abduction, ensuring that my client's leg stays straight and stabilized the whole time. And abduction, this mannequin won't go, but making sure that their leg is straight and supported, crossing the body's midline 5 to 10 times as well. With external rotation, we're going to turn that pinky toe towards the bed, and we'd be turning this way 5 to 10 times, and same with internal rotation, turning that big toe towards the bed 5 to 10 times. Next, I'm going to need my assistant's help. We're going to go ahead and move my client up in bed with the bed positioning. So when doing this, I'm going to take the pillow out from underneath my client's head and move it to the headboard, just in case we were to be a little too resilient with our movements here. We're going to roll this draw sheet up, grabbing by my client's hip and the shoulder. So your body mechanics while doing this is my dominant foot is going to be in front of the other, and it's going to be angled towards the head of the bed. And my non-dominant foot is going to be further back from my dominant foot and aligned with the footboard. So it's important to start with all of your weight in that non-dominant foot, and when you're moving, shifting it to that dominant foot. Okay, Mr. Smith, we're going to move you up in bed on 3. 1, 2, and 3. Perfect. Moving that pillow underneath my client. And next we're going to do some bed positioning. So while doing this, I'm going to instruct my client that we will be rolling onto his left side. We're going to do a left lateral position. I'm going to have my helper here go ahead and roll this. On this side, I'm going to have my client bend their knee and put their hand in front of them. So I'm going to have you grab at the hip and at the shoulder of that draw sheet and turn on 3. Mr. Smith, we're going to roll to your left side on 3. 1, 2, 3. I'm going to take a pillow, lay it underneath my client from shoulder to hip, tucking that and returning them to their back. So I'm going to have my partner here go ahead and pull my client's shoulder out from underneath them. protecting patient privacy the whole time, using an extra pillow, and we're gonna go ahead and put that in between my client's knees. If I had an extra pillow, I would go ahead and put another one underneath their forearm right here. So next we're gonna return them back to a supine position. I'm gonna take that pillow out from underneath them, and I'm gonna have my helper here do the same thing. Assist Mr. Smith to his left side so I can pull this out. On through, Mr. Smith, 1, 2, 3. I'm gonna pull this out, return my client to their back. Let's move them over. Let's move him over. Okay, Mr. Smith, 1, 2, 3. Perfect. So with a supine position, I'm going to put a pillow underneath my client's legs, right under the knees, just making sure that I'm not putting it too tightly up in the knees. That could cut off circulation. And then next, I would go ahead and put a pillow underneath each forearm on both sides, this side and that side. That's just going to protect their skin integrity. So next, I'm going to move my client into a semi-Fowler's. So I'm going to go ahead and take out all of the pillows underneath my client. Raising the head of the bed, Mr. Smith. And the foot of the bed as well. I'm going to start lowering the bed to a working height. So from this position, I would apply a gait belt to my client. I'm going to go ahead and take an orthostatic blood pressure before we move to the edge of the bed. So I am going to have my assistant here come into the picture. So I would apply the gait belt to my client laying in bed, instructing them that we are going to sit up and turn to the edge of the bed. So when my client is on the edge of the bed, we would dangle for 1 to 3 minutes, making sure it's a good position so her feet are flat on the floor. I would take another orthostatic blood pressure in between those 1 to 3 minutes as well. So next I'm going to apply a gait belt to my client. When applying a gait belt, it is important to make sure that you get a good tightness on this, making sure that you can put 3 fingers in between your client and the gait belt, and that it's in the good position, right at that waistline. So before doing this, I'm going to instruct my patient that we'll be getting up from bed, and we're going to move to a chair. I'm going to align my feet with my client's. I'm going to use good body mechanics, bending at my knees, grabbing onto my client's gait belt with both sides. Okay, Mr. Smith, can you grab onto my upper arms? We're gonna stand on 3, nice and tall. 1, 2, 3. I'm gonna have you shuffle to your left. Take 2 big steps back. And go ahead and grab that chair. We're gonna sit down. So in doing this, I would make sure that my client has good position. They aren't slouching, they're comfortable. If this were to be a wheelchair, I'd make sure that my wheels were locked and my foot pedals were out of the way. Before we stand up and ambulate, I'm just going to make sure that my client is in good condition. They aren't nauseated, they're not lightheaded, they feel like they can go ahead and stand up and ambulate. Do you feel good, Mr. Smith? Okay, so using the same body mechanics as before, I'm going to align my feet with my clients, bending at my knees. We're going to stand on 3 nice and tall. 1, 2, 3. And to ambulate, I'm going to go ahead and move to the side of my client, grabbing the gait belt far from me and closer to me. My client does have shoes on. If she didn't, I would make sure she'd have grip socks on. Go ahead and start when you're ready, Mr. Smith. Making sure that my client feels good, assessing their ability as we go. If they were needing a break, I'd find a good place to stop. We're going to go ahead and return back to that chair, Mr. Smith. Perfect. So from here, I'm going to measure and apply TED hose to my client. When doing so, you need to obtain a measuring tape. So we are going to measure for knee-high TED hose. So I'm going to have him my client take their shoe off and go ahead and pull up that pant leg. So when measuring for a TED hoe, you're going to measure 1 inch down from the knee down to the plantar aspect of their foot. And that measures at 14.5, and then you're going to measure the largest part of the calf as well. And that is about 16 inches. So next I'd go to the supply closet, I'd obtain the correct size of TED hose. And there's many ways to apply TED hose. So the easiest way that I have found is I'm going to insert my non-dominant hand into the TED hoe, stopping at about the heel area, and then I'm going to go ahead and pull it inside out, exposing my thumb. So this makes it easier when I'm applying this TED hoe to my client to get their heel. It'll just slide right in like that, and then just pulling the rest of the TED hoe directly up. Making sure that it fits correctly, there are no wrinkles in it, my client is comfortable in it. The toe opening is where it needs to be. The purpose of this is to check my client's circulation, and as you can see, it's at the right position and there's no wrinkles in them. Next, I would make sure that my client was comfortable and they feel good with that TED hoe on. So before leaving my client's room, I would chart any assessments I made, I'd gather all of my materials and perform hand hygiene.